Hello, everyone. We're just going to wait a few more seconds for more people to join. So bear with us. Okay, thank you very much for joining us today. I think we'll start now. A very good morning, a good afternoon, and a good evening, wherever you are in the world joining us from. A very warm welcome to this session on accountability in practice. And thank you for being here. My name is Sarah Bandali, and I'm the Director of Design and Innovation at Options Consultancy Services. And I'm delighted to be chairing and moderating this panel today. So we'll start off with a brief presentation on accountability and then move into a discussion with our panelists. I will then turn it to all of you in the audience to ask any questions you have. So please, as you're listening to the discussion today, do add your questions into the chat. And once the time comes, we'll ask you to unmute yourself and ask you to identify which panelists you'd like to answer your question. So without further ado, I would like to introduce you to our esteemed panelists. I'll ask them to unmute themselves and turn on their video one by one. So I'll start with Adriani, please.
Hello, I'm Adriani Martin-Hilber from the Swiss Tropical and Public Health Institute, and also with the HERD project of USAID. And I'm very pleased to be here. Welcome, everybody.
Thanks, Adriani. And I'll turn it over to Alison.
Good morning, good evening, and thank you, Sarah. My name is Alison Annette Foster. I'm the Vice President of WIHER, that's W-I-H-E-R, and that represents women in health, education, and rule of law. And we are a woman-owned small business. We're headquartered in the United States with permanent staff in multiple countries across the globe. We've been in business for 10 years and started with a team of 2 and now have a team of 20 and a permanent staff. And we work in social and behavior change, monitoring and evaluation, adaptive learning and capacity building. And what we're known for is gender equity and social inclusion. That's the cornerstone of our work. And we use a methodology called IDARE to build capacity for developing mechanisms for social accountability and for sustaining those mechanisms. We're here today to join in because we've adapted the framework to be an instrument of diagnostics, assessment, and accountability of national programs. Thank you, Sarah.
Thank you, Alison. And I'll turn it over to Esther now.
Hello, everyone. My name is Esther Agbon. I'm the Senior Health Financing Advisor based in Abuja, Nigeria. I work with Evidence for Action in Nigeria. Thank you.
Thank you, Esther. I'll now turn it to Bev.
Hi, my name is Beverly Johnston, and I'm the Chief of the Policy, Evaluation, and Communication Division in USAID's Office of Population and Reproductive Health. And I oversee a portfolio that supports the enabling environment for family planning, which includes policy, advocacy, finance, and governance. Thanks.
Thank you, Bev. And I'm going to see if Thambiko is now with us. Thambiko, are you there? Okay, I think our colleague has had some difficulties joining, so we'll see if he's able to join us a bit later. For now, we'll turn to Trish to introduce herself.
Hi everyone, my name is Trish Doherty and I'm a technical specialist at Options, and I work very closely on our accountability programs across Africa and Asia. So delighted to be with you today. Thank you.
Great, thank you everyone. And I'd just like to mention that in the original invitation, we had Tijani from the Bill and Melinda Gates Foundation, who was meant to join us, as well as Adeneke from Evidence for Action. However, due to unforeseen circumstances, they were unable to join today and do send their apologies. So I'm really pleased that Esther is stepping in on behalf of Adeneke. So we'll start the presentation off with a little bit of a definition around accountability and what this means in practice. So accountability is a fundamental democratic principle of democracy where citizens hold their elected leaders to account, to commitments, and decision makers in turn have an obligation to be accountable for their actions. It's required to keep the public sector transparent and productive, and it's a part of a social compact between citizens and government, outlining responsibilities expected from both parties. In this presentation, we refer to accountability mechanisms throughout, and what we mean by this is it could be, for example, civil society organizations, it could be the media, but it could also be internal structures such as parliamentarians who hold government and leaders to account. So we'll be exploring more of these groups and mechanisms in this presentation. I'd like to now turn to the importance of accountability. Accountability has been widely cited as a key strategy to advance sustainable development goals, to achieve universal health coverage, and also to improve health outcomes and rights. It will also be crucial in the response to COVID. Accountability sheds light on where advancements have been made and where there are gaps. Now, turning our attention to COVID. In this current context, COVID has changed our world, and accountability is a necessity to combating this virus effectively. With increasing cases, there's an immense pressure placed on the health systems, which means that governments have to rationalize their services, equipment, and drugs. Government attention, as we know, has been diverted to address the economic and health consequences of the virus. And we know that C-19 as well is affecting health outcomes adversely for women, children, and adolescents, as quite scarce resources are taken away or diverted away from essential services. So it becomes very crucial that credible information and data is made transparent to build public trust on the decisions taken during this pandemic. I'd also like to touch briefly on the development and rollout of COVID vaccinations, which of course is a game changer globally. However, there are issues around the equitable distribution of the vaccine. So it's imperative again that there's full transparency and accountability with clear pricing structures on the vaccine, as well as how it's distributed. So now coming back to the challenges for pursuing accountability actions. We know that accountability is important, but we also know it can be abstract, it's complex, it's difficult to comprehend and to implement. It's also particularly challenging to measure the contribution of accountability actions towards observed outcomes and impact. There is also limited understanding to measure what accountability processes actually contribute to change and what decision makers, how they respond to those changes as well. So what processes in the accountability cycle do they most respond to? So in response to the lack of tools to actually measure accountability interventions, we've published a paper recently in the Journal of Health Policy and Planning, which is an accountability framework. So 3 of the authors are on this session, so Adriani, Trish, and myself, but I would also like to recognize Andrea No from Novometrics, Rachel Cullen from MSI, and Tunde Shegun, who's a global health consultant in Nigeria, for their work on this. This tool was informed by experiences in implementing accountability initiatives to progress maternal and newborn health, as well as sexual and reproductive health outcomes, but can also be used for wider global health priorities. It was examined by global experts and it was piloted in 2 states in Nigeria. So I'll talk a little bit more about the framework itself. The tool is one that people or groups or organizations who work on accountability can assess how they are doing to achieve their goals for a particular problem or issue within the health sector. Drawing on the literature and our own experiences, we've categorized accountability into 4 key stages at the bottom of this diagram. The enabling environment stage is the first one, and this encompasses sort of awareness raising, the design of the accountability initiative, and political will. The next stage is the accountability cycle. So this is the monitor, review, and act cycle, which may be familiar to many of you as it's in a number of global instruments and documents. We then proceed to institutionalization, and this happens when there's sustained country-driven changes that are embedded within the system. And finally, we move to transformation. This is systemic change where we see alterations in norms, behaviors, and policies. Speakers will bring these different stages to life. I just wanted to note that a functional accountability mechanism usually involves that group or mechanism meeting the 2 stages around enabling environment and the accountability cycle. But for an effective accountability mechanism to be established, it really does need to push into the institutionalization and transformation stages. So I'd like to show this diagram in a circular form and talk through some of the accountability markers, which are characteristics drawn from the literature of what an accountability mechanism should undertake. So I'll briefly talk about these accountability markers within each of the key stages of the frameworks. So starting with the enabling environment and awareness raising, we have a few accountability markers there. So political will and stakeholder commitment. This involves government, NGOs, and others who make a formal commitment to improve accountability based on a plan, a strategy, a declaration, etc. We also have partnership structures. So it's ensuring that the accountability mechanism has the right and the relevant stakeholders, which include, for example, government, traditional leaders, healthcare providers, and others who are in a position to influence change based on the level in which they operate. And finally, appropriate design. Does the accountability mechanism have clear objectives and goals guiding their work? Now, moving to the next stage, I'll focus on the accountability markers for the monitor aspect of it. And in this stage, we have data quality, transparency, and packaging of the evidence. So this is really looking at how accountability mechanisms themselves collect, use data, and review the data to meet their own goals and objectives, and how this data is presented in a way that is understood by multiple stakeholders. Moving to the next stage of the cycle, on review, the accountability markers there focus on appropriate solutions. So when accountability mechanisms undertake a review, there is a review process that encourages stakeholders to focus on a solution based on the evidence. It also encourages them to take actions which take a health systems lens, and that can be targeted to different levels of the system where their people are there and in a position to act. The feedback loop is important because learning and decisions that are taken as a result of the review need to be communicated internally and externally. And finally, equity. This is equity in terms of membership of the accountability mechanism, but also looking at equity in terms of who we're reaching. particularly the affected population groups that we're helping to or supporting to improve health outcomes for. Now, moving to the ACT bit of the cycle, we have accountability markers focused on incentives for action. So there are both positive incentives and also adverse incentives. So the positive incentives for decision makers who implement accountability actions could include, for example, public recognition, improved career prospects, or additional funding. The consequences, however, for inaction could be disciplinary procedures or litigation. Attribution and contribution is also important for the accountability mechanism, and whether there's clear evidence that improvements to address the problem or issue is actually wholly or partly in response to the work of the accountability mechanism. Now, moving into the institutionalization stage, this is really about incorporating actions into routine practice. So accountability markers here, for example, will focus on country ownership. Is there a public sector body or an organization that is taking on responsibility for ensuring that these improvements are maintained and sustained? We also look at sustained change to progress over a long period of time and the extent to which these practices are embedded within the health system. And finally, we look at scale up. So once the accountability has successfully implemented what it's meant to do in their own geographical areas, whether that serves as an impetus to then scale up those accountability actions to a broader geographical area. And finally, I'd like to just end with the accountability markers that sit within the transformation stage. So this is really focused on systemic change, where we're looking at changes to behaviors, norms, policies that will significantly improve health outcomes and have addressed the problems that the accountability mechanism was seeking to change. So I hope that provides a good description of the accountability framework. And as noted, I'd really like to now ask our participants to come in and to bring these, this framework to life through some examples. So I do want to check actually if Thambiko has managed to join us. Okay, unfortunately, I don't think he's available at the moment. So hopefully he'll be able to join a bit later. But in the meantime, I'd like to pose my first question to Esther. So Esther, I'd like us to set the scene. Could you describe why accountability is increasingly being used to advance and solve health challenges in Nigeria?
Thank you, Sarah, for that question. Why accountability is being used increasingly in Nigeria is because we generally have seen the benefits of accountability and, in Nigeria in terms of how it works and the benefits that accrue to it. I'll start from, let's look at the national level, for instance, not necessarily the Evidence for Action project for now. You recall that we have the commitments on the FP 2020 and which were reviewed. So accountability has helped in that aspect to hold governments accountable to those commitments. Initially, when those commitments were made between 2012 and up to date, those the budgets were not met. And then it was when civil society got involved and then practically working together with governments, asking those questions. And like you said in your presentation, transparently and public participation. Then they began to open their books and, the commitments that the Nigerian government had, placed, they were able to put that in the budget. So they had this counterpart funding, but they were not funding it. But right now that funding is clear. At some point they had challenges and this was discussed openly, and now they reviewed their commitments and now they have kept to those commitments for the amount that was said was going to be the share of the government. That is at the national level. So that's the beauty of accountability, because when people ask questions, they are able to ask these questions. The questions are now answered. and the government opens its books and then people collectively benefit from that. So there's money available put in place for family planning. So at the E4A level, we have worked across 3 states in Nigeria presently, but before now, I think it's a total of about 6 states. And we have seen the beauty of accountability across many aspects of our project, like the maternal perinatal death surveillance response, the actual monitoring of maternal and newborn child health budgets. So for instance, you find out that right now, there's the ministry is open to planning with the civil society. We plan together, we ensure that some of the priorities that they also are part of agreeing to and planned and put into the budget at the planning stage of the budget. And then there's also the follow-up when it's time for budget implementation, whether those budgets are being released. And then also at the time of evaluation and audit, how the budget performed. So interestingly, they have come to understand that this is a process that is mutually beneficial. So it's strengthening the system as well as the beneficiaries are also being reached by those services. Thank you. I would like to stop here for now.
Thank you so much, Esther. You point to some really interesting insights in terms of transparency being vital, as well as citizen and government engagement, and then co-jointly developing solutions. So really useful to hear that. I'd now like to turn it over to Beverly. And from a donor's perspective, could you describe how you integrate and prioritize accountability within your current portfolios?
Thank you, Sarah. So from a USAID perspective, we look at accountability from a broad agency perspective, for one thing, because accountability is an essential component of our agency's vision to self-reliance approach. And that includes building a country's capacity to plan, to finance, and to implement solutions to local development challenges and ensure that there's a commitment to see these solutions through effectively, inclusively, and with accountability. So USAID strengthens the ability of partner countries to sustainably support their own development agendas through components that accelerate the country's journey and help align incentives around the goals of greater self-reliance. So USAID is doing things like reimagining its partnerships and partnership models. So the agency has placed a greater emphasis on partnering with local organizations and the private sector. So just for an example, we have a new partners initiative that elevates local leadership and increases our direct agreements with new and local partners, which fosters creativity and innovation. This accelerating and aligning around the concept of self-reliance also includes issues around democracy and governance. So that includes strengthening democracy and democratic principles of citizen engagement and government accountability to its citizens. So accountability systems ensure that public resources are planned and used efficiently and effectively and are responsive to the citizens' needs that are expressed. So a culture of accountability creates an environment where norms, attitudes, and behaviors and incentives reinforce formal legal requirements underlying the public financial management system, just as an example. It also includes issues around financing self-reliance. So the USAID strengthens partners' countries' ability to finance their own economic and social development by mobilizing public revenues and expending resources effectively, transparently, and with accountability, while creating the enabling conditions for private investments and functioning capital markets. It also includes things around global health. So in the global health sphere, which I'm most familiar with, we're incorporating social accountability approaches into our health programs to catalyze health outcomes and a wider range of governance outcomes, such as empowerment, participation, and responsiveness of duty bearers. We also further the understanding of social accountability through social science research activities and global participation in professional social accountability networks. So just as one example, our USAID staff were active in the Measuring Social Accountability for Health Community of Practice, which is organized through the WHO. And we recognize the programmatic outcomes that could have an effect on health outcomes, such as changes in community trust of health providers. And we realize that these are tough to measure and are not widely accepted. So when our own staff, technical staff, are part of global technical conversations, we get to know more about global innovations and be part of some global innovations, global innovators, global health innovators. So it's important for us to stay involved in those networks. We're also currently supporting activities that explore the usability and effectiveness of social accountability frameworks like Sarah just described, and using those frameworks for tools for accountability programming. And we're exploring how the social accountability implementation and research communities can better document and measure social accountability activities to improve consistency in reporting about program results and help us in our own learning agenda in that. And just as one more example, we've recently completed a review of youth-led social accountability for health activities, and that's going to be released soon. The review noted the dearth of documentation and analysis of youth-led activities. So there are opportunities to improve youth social accountability practice rather than just youth inclusion activities. And that's in order to increase youth leadership and to improve the responsiveness of youth and responsiveness, of health systems to meet the needs and rights of youth. So thank you, Sarah.
Thanks so much, Beverly. And it was really interesting to hear USAID's focus on supporting the country on their journey to self-reliance and looking at accountability at multiple levels. So key concepts around empowerment, responsiveness, which are very much linked to markers in the enabling environment stage. I'd like to now probe a little bit further on that by asking Adriani, if you can talk us through how programs you support have built an enabling environment for accountability and also the impact it has had.
So in terms of, hello everybody, in terms of building an enabling environment, I think one of the first steps and one of the critical steps of building the enabling environment, i.e. getting the right people on board to help put accountability into the system, is making sure that both rights holders and duty bearers are at the table. If you take the quality of care example, where you have a community, let's say, that is pushing for, advocating for quality of care from their local facility. Many of us have been involved in accountability actions, social accountability actions, where we try to get, let's say, the local facility or providers to ensure respectful care or improve the quality of care of the facility. It's not really enough, we have found, to just have communities and providers working together, because you're going to quickly come upon the problem of the providers don't have the finances, the means to actually deliver the quality of care desired. And that makes the provider both a duty bearer in the sense that they are obliged to try to provide quality of care, but they're also a rights holder. If the system itself does not give them the means by which to provide quality of care, they can't actually be held accountable. So if you think about who needs to be involved, for that provider to be able to deliver quality of care and to put in place accountability mechanisms, we're also going to have to include, for example, the district managers. You have to include higher level Ministry of Health officials and even Ministry of Finance. When you have all of these players involved from the beginning, you're much more likely to be able to embed and first to create accountability within the system, but not only as a one-off, but also to create the mechanisms by which accountability can be delivered. By doing this, you get, in fact, the rights holders, let's say women that are going for maternity care, you get the communities, community leaders, you get the providers on board, you get the managers on board, and then you also get the higher level health ministry folks on board, and together they can put in place an accountability mechanisms. One of the key problems we've had in trying to put in place accountability has been the lack of the vision of what success will look like. When do we know we've achieved? The difference between advocacy and accountability, and I'll come back to this later, is really in putting in place a referral mechanism, not a referral mechanism, a recourse mechanism by which someone is held accountable or answerable for the decisions made by the collective. And by doing this together and involving the right people from the start, you're much more likely to have an effective mechanism in place at the end. And so being very clear about what it is you're trying to achieve, what that will look like, and who needs to be involved right from the start will help create an enabling environment and engage the right stakeholders to have a meaningful outcome. So I don't know if that answers you, Sarah, but hopefully that does.
That's brilliant. Thank you, Adriani. That's really helpful. And I'd like to expand on what you've just said in terms of membership of the accountability mechanism, because of course we know as part of the enabling environment stage, having multi-sectoral and multi-level partnerships within that is really important. So I'd like to ask my next question to Esther. So Esther, you've been working on the Evidence for Action Mamaye program for a little while, and as we know, that focuses on evidence advocacy and accountability to improve maternal and newborn health outcomes. And one of the successes, of course, is bringing together this multi-sectoral partnership. Could you discuss the importance of that and what it has meant to the program in Nigeria?
Yes, thank you. This partnership, like I said, is one of those partnerships we say is very unique and has brought people together, all the stakeholders, like Adrian just said, who needs to be involved. And so looking at A4A has done that sort of assessment, supporting the stakeholders, supporting civil society to get all the people or bringing all the stakeholders on board. So you have the civil society, you have government, you have the service providers, you have professional bodies, you know, and the media all coming together to work for one common goal. And again, it says, I will draw from Adrian's response to when she said they all need to know exactly what success means. And so for us in E4A, we've supported I'll call them a coalition now, the state-led accountability mechanism. So this is what it's made up of, all of the stakeholders I've just mentioned. We call them state-led accountability mechanisms. So we've supported the mechanisms to put together a plan to visualize what success would look like. And then most importantly also, they need to identify what roles each of them will be playing. So you find that government is in there and government has its own role. Oftentimes, mainly, they come up with evidence, they bring the data to the table where everyone works together to ensure that they all pick up the evidence that they need concerning the issue, especially as regards maternal and newborn health, where we are focused on. Okay, and also civil society, they know where their strengths are. They know mostly they're involved in advocacy. So collectively, the work using that evidence, they use it to advocate for the solutions they have collectively developed together. So it's a unique sort of collaborative that has, you know, because of working together, they have become, the trust issues have, you know, they have more credibility, they feel trusted, they're working in an unthreatening environment. So again, you see governments and civil society, ordinary people working together for a common goal. So I say to that sort of, the slams are very important because they have created that enabling environment. And the enabling environment simply here is the trust that they've built among themselves. So they're not threatened, government is not threatened that if I come to the table with data around, for instance, a facility or a maternal death issues, there would be accusations or there would be blamed. No, they are open this way to bring up those data and to discuss them collectively and provide solutions. So, and those solutions, if need be, and it needs to be taken up to a higher level of policy stakeholders, then tools are used. They're presented in, they are packaged. Just as we saw in the presentation earlier, you can see on the slide now, you have scorecards. These evidence are packaged and then they used to carry out advocacy. So in a nutshell, I would say that the partnerships have worked. They are very important because working together with governments on the same table, co-developing solutions, I think is the best way to go. Thank you.
Thank you so much, Esther. And now I'd like to turn it to Alison, because while looking at accountability mechanisms and actions, we also need to consider equity. So Alison, how do we consider equity and ensure that within the roles and membership of the accountability mechanism? It would be great if you could describe strategies you have employed at WIHER.
Thank you, Sarah. And I'm glad we're talking about equity because it's such an essential piece of successful social accountability mechanisms as they become sustainable and institutionalized and positioned to become transformational. And with that, equity is inclusion. And that's particularly important as we have watched social accountability evolve, not only within the steps, but as we've all kind of talked about, as that applies to governance and self-reliance, it is not only who is at the table, but how much influence they have and are they being able to speak. So we at WIHER, because our main thrust is gender equity and gender empowerment and social inclusion, we are very aware that even within those rights holders group that we give voice to or bring to the table, we need to always be looking at that shifting power dynamic to see who is at the table, who's not at the table, who's not there, that are often the women, the youth, the poor. And now we look at growing migrant populations and refugee populations. So you have host communities and refugee populations that both need to be heard, and they need to also work together. And so part of our work at WIHER is to build that co-creation that you're talking about, that we use, as I said earlier, a methodology called IDARE, which is identify, design, apply and assess, record, and expand. And it gives people that ownership of working together and unfolding their own barriers to inclusion and to equity, and where willingly or unwillingly they are leaving people out. And those that are left out can look for opportunities to join in the membership. The second area that we look at is when you bring those people together and those social accountability mechanisms evolve, we want them to evolve. We want them to be institutionalized. So as we watch them, and as we watch this maturity, if you will, of social accountability, where they've come from localized projects or efforts to maybe regional or networks of social accountability practices, and then hopefully they become to some kind of institutionalized system that is sustainable and also continues to grow. We need to think about how we then hold that system accountable. How do we monitor it? How do we articulate it? What are we looking for? And this framework offers a very useful opportunity for us to explore those things and adapt that framework to perhaps measure, monitor, and report on that. And as those evolve, it will be very important for all of us in the global community to make sure that that institutionalization keeps the focus on those rights holders that it was initially conceptualized to protect and to advance. And that's so important. And the third and last area of equity that WIHER is exploring, and it's a very provocative area that there's a lot of conversation now about, and we feel very strongly about, and I'd like our participants here today to be thinking about that as we have this conversation, is what does equity mean as we evolve? Meaning that when we bring people to the table, we are not just, and I think Adriana mentioned, alluded to this, as we bring people to the table, they are no longer just recipients. If there is real equity, I am not just recipients of those services and of what the system is duty bound to give me, but I am also an actor and with my own accountability and my own duty to make that happen. Not how I use those services that are made available to me, how I participate in the social accountability process and hold that system and those duty bearers accountable, and how I too am responsible to contribute. And that's real equity. And that kind of measuring, monitoring, and articulation is what WIHER wants to advance and to facilitate. Thank you.
Great, thank you so much, Alison. And you raised a really important point. All of those points were very valuable, particularly in empowering those who participate themselves in accountability processes. That's a key cornerstone and aspect of ensuring equity, and also enabling them themselves to be the holders of some of those responsibilities.
Sarah, can I interrupt 1 second? I just got a message from Tumbiko, and he asked if you could invite him again. He's not sure. He has a very unstable internet right now due to a storm, but asked if you could invite him to join if he's able to.
Thank you, Alison. Yes, I would love to invite Tumbiko. Please do come on the line. It'd be great if you could introduce yourself, and then I have a question for you.
Thank you so much. My apologies, I've had internet connectivity challenges. My name is Tumbiko Msisia. I'm the technical director for Community Scorecard Consulting based here in Malawi. Thank you.
Brilliant. Thanks so much, Tumbiko, and really wonderful to have you. So while I have you on the screen, I do want to ask you about really the next stage of the framework. So this is around the accountability cycle. And my question for you is, data, as we know, is very crucial to holding decision makers to account. It would be great to hear from you how you use data in Malawi to progress the accountability work.
Yes, thank you for that question. Indeed, data is very critical when it comes to social accountability, and specifically social accountability. Looking at the process of implementing the accountability mechanism and also the outcomes of interest you want to get by the end of the day. So like in Malawi, for example, we have a community scorecard approach which CARE has been implementing. In this approach, we've seen that the indicators that are developed, which demonstrate satisfaction levels. But for you to demonstrate the satisfaction levels, you need to generate data, people's opinions on how they are satisfied, the levels of satisfaction with the services. And I think critical also is what Alison mentioned.
Oh, I'm sorry, Tumbiko, we can't hear you anymore. Okay, I think unfortunately we've lost Thambiko. I'll check in with him a bit later if he's able to connect back online. But while we wait for him, I'd like to maybe bring back Esther. And if you could also maybe speak to the role of data and the strategic use of evidence, and how data is used to incentivize action amongst a variety of stakeholders, including government, healthcare providers, and others.
Yeah, Sarah, thanks for that question. Data is, in fact, I would say pivotal to all accountability work. Without data, I mean, there's no evidence. So, and the evidence, when it's also visualized, goes a long way to change, mindsets. So again, it's very important that we work with data, and data must be factual and credible. And then for E4A, what we have done is to ensure that we work with government approved data. In fact, the data that is produced and stored by government. So we use the DHIS, the HMIS, that's where we bring out this data. And when I say we, please, I don't mean E4A, but E4A supported coalitions. And I'm talking about these state-led accountability mechanisms. They've used this data in several ways to really change government actions and the system in the health sector. In the last, for instance, I'll use an example with stocks of essential commodities in facilities. This happened in Lagos, and it was the scorecard was done across 74 facilities in Lagos State. At the time, as at 2015, when the coalition began to meet and began to work with data, you would imagine that only about 45% of the facilities had stock. In a quarter where you go, only 45% of facilities have stock. But at the end of 2019, because of the use of data and tracking, you've seen that this it increased to about 98%. So 98% of the facilities were fully stocked. And what does this data reveal? Data, of course, will just tell you the numbers. But again, sitting together and discussing what the issues are and bringing out those solutions, co-creating those solutions within the collaborative, the state-led accountability mechanism has really supported the use and incentivized government to begin to depend on data. Interesting, because they have seen these changes and they want it more. So this system is now working independently of support from E4A, because they now see a reason why they should be tracking this information regularly and ensuring that the facilities are fully stocked. So yes, I would say that this is, when governments see this practically happening, they are really excited to begin to put more efforts. And then in the sense that it also supports budget utilization, and then it would also help to see that more allocations are made towards that aspect, because when budgets are not utilized, then also they experience budget cuts along the line. Thank you, Sarah.
Thank you so much, Esther. And it's useful to hear about sort of how accountability mechanisms have used data to actually influence these types of changes, as you mentioned, on life-saving commodities. But sometimes, actually, we know that accountability actions don't always have the intended effect or outcomes. So looking back to the accountability cycle, which focuses a bit more on the recourse mechanism and remedial actions that can be taken, I'd like to ask another question on that to Adriani. Could you tell us a little bit more about what a recourse mechanism is and its importance?
Sure, thanks, Sarah. I mean, I think in all of the different mechanisms that Esther and others have talked about, we need to think about the differentiation I mentioned earlier between advocacy and accountability. accountability, unlike advocacy, does have that bite to it. It means that someone is answerable to someone else. So a duty bearer is answerable to a rights holder in normal circumstances. So if we say that we are trying to put in place an accountability mechanism, you can think about recourse mechanisms or that answerability in three ways. One is there can be soft recourse mechanisms. So for example, if we are trying to get back to my quality of care example, a group at the community is trying to improve the quality of care. There can be a shaming of the providers. You can use scorecards to benchmark facilities against facilities, and using peers, providers, competition. There can be, I call it shaming, but it's a way of incentivizing facility managers and providers to engage and try to improve. That's probably the softest accountability mechanism. A more perhaps powerful mechanism would be what I would call a medium recourse mechanism, something like supportive supervision. And then I'll talk about the MPDSR cycle. There you have in the maternal death review and perinatal death review cycle, you have the identification of the problem, but then you have providers themselves deciding with managers how the information will be collected. And once it's collected, then they analyze the problem and come up with what is the solution. Perhaps the solution is to look at human resource planning or blood banks or the skills of providers that are there or equipment. And then those changes, if you have a feedback loop, then get followed up on. That would there be the recourse mechanism. It would be an internal process, and providers, managers together could in fact improve and create accountability for themselves. This could also be done and has been done in a more punitive way, where there are problems that are identified. And that takes us to a more harder accountability mechanism, which would be regulatory. There, the provider could, for example, be charged with negligence or malpractice. So if we think about recourse mechanisms and answerability, we have to think about at what level are we able or willing to put in place. And it's not necessarily the case that a harder option, for example, a legal or a regulatory option, is the best way to go. Because what can happen is that people stop engaging. So providers may stop engaging. If you think of the MPDSR cycle, they may stop engaging and stop giving the information if the consequence is too punitive. So we have to think through these ways in which accountability not only can be assured, but also what would incentivize and create a process by which quality actually improves. It's not given that that everyone wants to engage, and therefore it's important, as I said early on, to engage the stakeholders together and to come up with an effective mechanism that can be institutionalized without being too punitive to have folks not participate any longer. So I think depending on the kind of accountability one is looking for in a program, in a system, would determine at what level the recourse mechanism or the feedback loop would take. Perhaps the hardest example would be a legal accountability, where you have, there were cases, for example, in Brazil where there was a woman not admitted and she was moved on because they said they didn't have a pregnant woman was not able to give birth in one hospital, not enough room. They move her on to another place. and move her on and on and on until finally she gives birth in the waiting room of yet another facility, and she had twins and one of them died. That case was taken to the Inter-American Court, and Brazil was found guilty of actually denying the right to life for the child. And that would be perhaps the most, the hardest accountability mechanism, but it has also effects. So it really depends on the context, the environment, and what you're trying to achieve. But recourse is critical to accountability, and at what level just needs to be determined by the groups involved and the stakeholders engaged. Thanks, Sarah.
Thank you, Adriani. And that was really powerful and interesting that, you know, of course, the recourse mechanism really is dependent on the local actors, the context, and what you're trying to achieve. I'd like to now bring this work back to the health system change as a whole that accountability has had. I'd like to once again check in to see if Thambiko is still with us. Thambiko, are you there?
Yes, I'm here. Thanks.
Brilliant. So I would, maybe if you could answer this question, and maybe I'll come back to the previous one that I've asked you. So for this question, I'd really like to hear from you on what has accountability done for the health system in Malawi? What's worked, what changes have you seen, and what remains to be done?
So indeed, accountability has done quite a lot of positive contribution to the health system in Malawi. In the sense that there have been some changes at the local level, like you can see in the slide, where communities have been proactive to engage and take responsibility in some instances to contribute towards improving the health system. And the engagement with the district colleagues also has facilitated, through the social accountability mechanisms, has also facilitated the responsiveness of frontline service providers, but also higher level decision makers to make sure that they are providing adequate support to the duty bearers who are at the forefront of providing the services. But as we can see in the picture where we have youth groups, the issues of equity still come up. And in this case, we've seen through these mechanisms, we've seen the youth also taking a prominent role in one, analyzing situations to appreciate what are the key blockages that need to be addressed, and at the same time also being the champions of the change that they wish to have by the end of the day. So a very specific example is a case of one district where the youths actually implemented the community scorecard approach, and they identified what are the critical issues and provided suggestion. And they took it upon themselves now to facilitate the process where they brought together community members, and part of the community members were the youth themselves. They did the analysis and set up the priorities. On the other hand, they also brought on these meetings duty bearers who also shared their opinion about service performance. And in addition to that, they had to invite the district level players to be part of the conversations. So that responsiveness to the demands at the local level, I think, are being are seen to be one of the key achievements. And further than that, escalating to even the national level, because of the stories, the evidence that is generated from these processes, we've also seen where the Malawi Ministry of Health has integrated an approach like community scorecard to be used as a key approach for enhancing accountability and citizen engagement at the local level. So it's been integrated, built into the community health strategy for Malawi as a country. So indeed, there have been some improvement in the relationship between the service users and the service providers, but also mutual accountability existing between the two, and responsiveness on policy implementation and policy formulation processes. Thank you.
Thank you, Thambiko. And given that it's a very clear line now, if you don't mind, then also talking a bit more about the previous question I asked, which was really the role of data and how that plays out in your work in Malawi.
So data indeed is quite a critical piece of this kind of work, in the sense that we're looking at the process of implementing the accountability mechanism. How do you know that you are implementing in the most appropriate way possible? That is, one, inclusive, and the process that does not cause any damage, but is a process that indeed provides the encouragement not just to the communities, but also to the service providers. So the data that we've been collecting would include who are the people that are participating in this process. And apart from that, in terms of defining the satisfaction levels, what are the satisfaction levels over time? So for instance, you would have an indicator like the health workers adhering to opening time for the facility, which is another key element if indeed the services are to be available to the service users. So over time, they would track from the
Okay, I think we've lost, unfortunately, Thambiko again, but he did raise some very interesting points of kind of proxies and markers that do enable the integration of accountability. So a very great example of including accountability within community health strategies, which very much feeds into the institutionalization stage of the accountability process, and also that there is mutual accountability, there's responsiveness as well. So those are interesting factors to probe further into. I'd also like to hear on that same question actually from Esther, to hear more about actually what has accountability done to influence the health system in Nigeria. Again, looking at what's worked, what hasn't, and what needs to be changed. Esther, are you with us?
Yeah, sorry, internet was a bit unstable, so I didn't quite hear your question.
Sure, happy to note it again. So I'd like to hear more about how the accountability initiatives that you and others have been working on in Nigeria have impacted the health system. So what has changed, what has worked, what hasn't, and what more needs to be done?
Yes, indeed. A lot has changed in terms of accountability in the areas where we work. And I would say that at the community level or the user level, you know, we have seen a lot of positives around that area. For instance, due to accountability, family planning utilization has improved in terms of the users uptaking family planning. And this was actually directly linked to data that was established by the scorecards that, you know, clients were not accessing family planning services. And so we had to do a lot of work, the coalitions did a lot of work to ensure that, you know, commodities, funding for commodities was provided by government to ensure that the user fees were eliminated to ensure increased utilization. We've also seen a lot of changes around service providers in terms of service delivery. Like I just gave you the example, how the system has worked in terms of stocking up essential commodities for maternal newborn health. So, and also we have seen increased funding. That all of this is due to the fact that there are some practices that the coalitions have taken. And let me just not really say coalitions, but the coalitions have pressured government to really taking those practices. For instance, number one, they are self-assessing right now, like self-assessing progress. What are we doing? And currently, I can say that in the last, this last year, during the COVID period, pandemic, when we were in the pandemic, due to their self-assessment, they identified the fact that, you know, fundings have not been released on time. And so this has slowed down progress of some of the MSH activities. And so coming together, they worked virtually, we adapted our work and they worked virtually, and they could come up together with advocacy, targeting the right decision makers. And this, not only targeting the right decision makers, but the important thing was that they identified the problem and the issue, which was actually, government was not funding those programs because they thought that they were more administrative and were not really aligned to COVID response. And so with that information, you know, the health officials sat back and reworked those plans and resubmitted, and funding was released as at August. Almost 80-something% of the funds were released. So again, this is that practice that has come in, and that is what we want to see continue. Let it becoming a norm that they self-assess, you know, they identify the problems or the issues, and they take action on those solutions. So what remains to be done is actually seeing that this becomes a norm. Sometimes we look at institutionalization as if it's only about funding. If the government provides for funding, or we have put together this accountability program together, let the government just fund it. It goes beyond funding. So it includes the practices becoming normalized, becoming the norm, and people behaving that way. So we need to see that this self-assessment is sustained, and then the reviews are sustained, and then they take actions on solutions that they come up with. Thank you.
Thank you, Esther. Really insightful, particularly looking at the current crisis we're facing globally. So useful to hear that, and also your point about really the integration of practices to help further institutionalization. So thank you, Esther and Thembiko, for those insights from Malawi and Nigeria. And our other speakers, we've heard very helpful and positive examples of the changes accountability mechanisms have made. But I'd like to turn my next question to Alison to talk through, you know, beyond positive change, how does this framework and tool help us think through the sustainability of interventions?
Thank you, Sarah. It's been so nice to hear everyone's comments and how we're all on the same page. And I just want to say that we put up this picture. It's also in Nigeria. Waiher is working, is leading the gender and social inclusion work in with the Integrated Health Project that is funded by USAID Global Nigeria Project. And this is in we're in 5 states, and this is in one of the states and in the north. And we developed it, talking about institutionalizing accountability and creating these incentives, and these are soft incentives. We helped the local governments shift an existing desk officer position to a gender and youth desk officer position. And we did that by bringing together women and youth from that local community and talking about what that job description should look like, what the performance expectation should be, and how that, and what should hold them accountable to be responsive. And likewise, how could then they work together to create a social accountability mechanisms, and how would the youth and women participate in that, and what would be those feedback loops. And it was a very lovely kind of experience that we held over a number of days and then follow up in weeks, and have helped that develop. But this was from that, and I just wanted to follow up on my colleague Esther and bring that picture up. So we, as I mentioned earlier, Waiher has been working with a number of other authors and researchers, 2 are on this panel, Adriane and Thembiko, to look at how will we hold a social accountability program at national level or at a state level accountable. What will be that kind of monitoring mechanism for that? And what would that look like? And what is necessary for this kind of mechanism to be equitable, inclusive, sustainable, and et cetera, all the things that we've talked about today. So we've taken, and first of all, I would like to give a quick shout out to, there are 8 researchers working on this, and I want to call them by name. That is myself, of course, Kristen Mallory, she works at Children International, Beth Outerson, Adriane Martin-Hilber, Cassian Havajimana, who's working in Rwanda, Tumbiko, who's leading the research in Malawi, Lygia Paina, works with Johns Hopkins University, and Eric Sario. This is the team that's been working on this for a couple of years and has been very honored to take this framework. It's so robust and so useful, and it's evolved over time, even since we have worked with it. And that's been beautiful to be enjoying that and also participating in that. We have developed this into an instrument that we want to strengthen, test and strengthen, and to that will help governments to measure if their social accountability is achieving all those things. Will help, and in that instrument, we want the voice of governments, we want the voice of the rights holders that it serves, and we want a way to look at which section is not working and where we might work to help it. So we use a quantitative scoring, and also we use qualitative assessment information to be inclusive and be able to both objective and subjective in the way that we address the weaknesses and enhance the strengths. And I want to give a shout out to Bev, because she has helped us with funding from the Global Health Office of USAID, as well as the Rwanda and Malawi, to test this and to see, to make sure that it works. I want to be sure you're hearing me, because I know that it's difficult. I've been told it's difficult to hear me. Can you hear me?
We can hear you now. There was a bit of ruffle in the background, but it's fine now. Okay,
perfect. We are in the process now of testing this. We have IRB in the last stages of IRB in both countries, and then we will be testing this, completing the testing of this this instrument there. And what it looks like, it looks at structure. You know, is there a mechanism? Is there a policy? Kind of some of the things we talked about earlier. Is there a policy? Is there a budget? Are there resource plans? What are the functions? Are there processes in place for the feedback loop, for data and use? Is there a function for how you use that data, where it's collected? Are there communication linkages between and networks between all 3 levels, national, local, and community? And then, is it effective? Is it achieving what we hope that it will? And in our case, we are looking at maternal and child health and reproductive health. Is it achieving improved services in those areas? And then finally, is it transformational? Looking at are the pieces in place for it not only to change the health system and the way that it's functioning, but also to change that culture of accountability that Bev spoke to. Is it leading to that participatory and accountable and equitable participation of all actors in that process? Incorporated in this is in the way we are working now with this instrument is also a retrospective piece that is qualitative, where some quantitative, but primarily qualitative, where we're looking at what were the environmental, what was the political environment, the donor environment, the community environment that contributed to its sustainability, and trying to tease out what might be common. Of course, in this test, we could only do 2 countries, but we have some other countries in line who are eager to participate in this process, so that we can have a comparison across countries, like what are similar environmental factors, network factors, funding or structural factors that make these effective or not effective. So we're in the beginning stages. We've come a long way, and we're thrilled to present where we are in this, and then we'll be looking forward to give the results in this. Thank you.
Thanks, Alison. And yes, certainly we look forward to seeing the results of that. It will be really insightful, and perhaps another session we can join in on. And so you touched upon some of the factors around actually transformation, which is great because it is the last stage of the accountability cycle. And it is, as you note, not just changes in terms of outcomes and impact, but also the cultural shift towards more accountable systems. So focusing on that last stage of transformation, I'd like to ask my last question to Bev. From a donor's perspective, how do you view accountability as contributing to the transformation of policies, norms, practices, and behaviors?
Thanks, Sarah, for that. And I would say that from what we've heard from our colleagues on this panel today and from our own experiences, is social accountability in development, in the development sector, is indeed growing, it's evolving, and it's progressing, right? Or I think we're constantly learning new lessons and improving on what we have done in the past. I would say within health, and it's increasingly being recognized as a way or a potential way to improve health systems efficiencies and ultimately to improve public health outcomes. And we've heard some of that today. And I think social accountability from the development and donor perspective, that social accountability, particularly for health, it's grown out of that acceptance of citizen engagement and citizen participation activities. As well as some policy advocacy activities, right? It has a little bit of an origin in this evolution piece, right? We've gotten this acceptance of people being involved in their own development, which is fabulous, right? And that's different places at different paces and the like. So we've seen these efforts that link beneficiaries and government and governmental and local leaders and duty bearers in this, right? So we got beneficiaries, you've got government, you've got health providers, you've maybe health administrators and other local officials. You have these all coming together and interacting. And we're hoping that that interaction with policymakers and the public becomes more of the norm. And it leads to more policy dialogue and more responsive policy development, right? That's kind of that vision, that goal, and where we're working towards. But like I had said, we've heard a lot that there's evolving, we're moving forward, and I think that's good. When we think about social accountability, it moves forward from that engagement and from that inclusive component of with citizens. And it moves into that use of, again, accountability about those tools and approaches and measurement, and ultimately to the responsibility of those duty bearers to provide public goods, not just funds, as Esther mentioned, right? It's just not on the duty bearers to provide funding. It's also for them to provide other components that are part of public goods. And service users are supported to make their needs known to duty bearers and to, like I said, to hold them responsible for that quality health services that they're entitled to. We all already, Adriani talked about the need for quality health services and how that gets incorporated into social accountability and social accountability approaches. And we know that social accountability approaches can also raise awareness of what the available services actually are and build that trust between duty bearers and beneficiaries. And social accountability is also intended to ultimately improve accessibility as well as that quality of service provision. So I'll give you just a couple examples from USAID and from health, right? So USAID recently supported a fistula care project in Uganda that incorporated social accountability approaches, and it ultimately increased the use of maternal care service and family planning. There were health workers and community members assume this responsibility for increasing health service supply and demand, and they came at it from this informed point of view, where staff at the fistula care facility conducted a number of walkthroughs of their services and the actual facility for community members. And this ultimately improved the beneficiaries' understanding of even what the available services were at the facilities and ultimately improve the demand for services. So the accountability component was more about having joint quarterly meetings with community members and facility members and others to have two-way conversations and to continue feedback components and the like. So you see that accountability mechanism on top of just community interaction, right, and community engagement. And it's beneficial on two ways there. So you see that as just one example. The other example has to do with, maybe Timbiko can talk more about this if he knows more about this too, but in Malawi, most recently in relation to COVID-19, we have USAID has a health project, health activity that has social accountability activities within it. And they use community structures such as community health action groups and champion communities. And they have organized themselves to mobilize communities to curb the spread of the pandemic by conducting sensitization meetings, doing some advocacy and some lobbying, as well as visitation to some infrastructure in their communities after going through some COVID-19 orientation settings. So there's some movement ahead on using social accountability for in COVID activities. But I would add that there's a long way to go, right? So we've made some progress for sure, and there's great potential for social accountability programming to continue to improve and to add to development outcomes and going forward. So I think we as our own development agency have that long way to go to even better coordinate programming across development sectors. You know, USAID is obviously a very large institution, and we cover, I'm most interested in health and most familiar with health, but my colleagues from across many different development sectors incorporate social accountability. But we have a long way just to talk within our own agency and talk and share lessons learned and best practices and the like. And I think we can begin incorporating accountability measures into our community engagement activities that are more accepted, and to again move from community engagement to social accountability, and do that more consistently and more deliberately to make that link with normative change and supportive policies. So I'm so heartened to hear from my colleagues, and we'll probably hear more from others who are participating in this panel and in our audience today, that social accountability is changing, it's moving, it's dynamic, and that's so exciting, right? And I think we should use that potential to really make a lot of headway in the number of development sectors, and including health. So I'm very heartened by what I heard today. It's very uplifting, right? We need some uplifting news these days, and to see that there's such a good future ahead of us in social accountability, and there's some real champions. It's fabulous. So thank you, Sarah.
Right, that's really inspiring words to leave off on, Bev, and I completely agree with you. We're at an opportune time to really further accountability. We've learned a lot. We know what works, we know where we need to improve. And yeah, I would like to just take this opportunity to thank all of the panelists for those questions I asked. And in the true spirit of democracy, I'd now like to turn it to the audience to enable them to ask questions that they have for our panel as well. And as noted, I see some questions have come in on the platform. So I have Trish and Julia, who are helping me to co-moderate the audience participation. How we'll run this is great. You've put your questions and your comments on chat. What we'll do, Julia, if you could do the first one, what we'll do is ask you to unmute yourself and put yourself on video if you're comfortable. And please do ask your question and to whom you'd like, or which panelist you'd like for it to be answered. Julia?
Yeah, thank you, Sarah. So we had a question from Robert, or a comment as well from Robert Rapando.
Robert, would you be able to unmute yourself and introduce yourself before you present the comment that you shared in the chat? Hopefully that will work. Yeah.
Okay. So my name is Robert Rapando. I work for Options in Kenya for a project called Money QC. So basically the areas I support is health system strengthening with the focus on supporting the counties to plan and budget. One of the key things that I do is just to ensure how the government can use the limited resources to effectively deliver services to people. So it's all about accountability. Yeah, over to you.
Thank you, Robert. Was there a question that you had, or was that was sharing a comment, Robert?
It was a comment. Yes, a comment is not a question.
We then also have a question from Ariel Frisanjo. I hope I pronounced that correctly. Ariel, would you be able to unmute yourself and ask your question? Also, anyone can feel free to switch on their camera at this point if they like.
Yeah, hello. Good morning, good evening. Can you hear me?
Yes.
Hello, can you hear me?
Yes, we can hear you perfectly. Thank you.
Hello.
Hello, we can hear you. Oh, I guess the question is whether he can hear us. Ariel, can you hear us? Oh, otherwise,
I can hear me, Julia?
Yes, I can hear you. Yes.
We may need to ask the question on his behalf.
We do have it on the chat. I can send it to the. Sarah, can you see the question?
Yes, I'm happy to read it out. So thank you, Ariel, for your question. So you're a COPA, I hope I'm pronouncing this right, COPASA, C-O-P-A-C-A-H, steering committee member. So thank you very much for the framework proposal. So social accountability processes are not clockwork mechanisms. They are dynamic, sometimes messy. There's a lot of context-based that is shaped by unequal power relations. Political will doesn't come easy, and once the will is established, implementing it within frequently fragmented and vertically disarticulated health systems also needs decentralized will from those implementers. How do we build an accountability culture towards those usually discriminated against and excluded? Do one of our panelists want to take that question?
I'll take that question. This is Alison. You know, I think that I'm so pleased that someone asked that question, because this is something that we brought up early on in this presentation, that we certainly advocate and work toward a broader social accountability that goes beyond just one facility or one community or one network. But in doing that, it becomes more challenging, right? To be inclusive and to make sure that those that are the most marginalized, that often are left behind, are not then further marginalized by a bureaucratic kind of social accountability system that takes that access even further from them. And that's what we're trying to unpack and look at. It's not a normal measurement. It's not a normal monitoring and evaluation. It's going to be unique. It's going to require, as you said, a cultural shift. And that's really at the level that WIHER works. We work at that cultural level, at the national, at the culture of governance. What does it mean to be, I mean, we know what it means, good governance, but what does it mean to make that shift, and how do we accomplish that? And that shift that goes all the way down and comes all the way up. And I think that incorporates a culture of inclusivity and equity. And again, I will point out that those that are most marginalized, those populations shift, because as we try to integrate societies and erase or disempower biases or prejudices, then we have other shifts that are happening at the same time, and there's always those that just can't get access. So that's where I think the global community plays a big role. And these incentives that Adriane mentioned need to go all the way down the line. There needs to be a global watchdog, and there needs to be, that's where advocacy and accountability come together, that we're both advocating to shift those norms, but also continually monitoring those norms, and we have to be vigilant. So that's what we're looking at, and it's not. I think Bev, you said that it's not easy. It's challenging. It's a little bit messy, but it is very exciting, because that is the goal. And it's a very exciting goal as this evolves and matures. So thank you for bringing that up. And it's not that I'm refusing to answer your question, but I'm saying there is no certain answer. It is something that it's a journey. Thank you.
Thank you. Thank you, Alison. Did any of the other panelists want to come in on that?
Sarah, can you hear me?
Yes, I can hear you now. Can you hear me?
Yes, something happened and I just was shut off. I will just try to highlight two issues. I'm Maria Frisancho from Compass Steering Committee based in Peru. One is if you could draw a little bit more on the problem of unequal power relations when coming to social accountability. Usually in Latin America, COVID-19, for example, has been a good X-ray on how our supposed to be powerful health systems have shown dysfunctional in terms of gaps and invisible barriers for socially excluded groups. And most of this is based on the lack of governance mechanisms, the lack of participatory mechanisms, and the power relations that are drawing all this. So how could we address this issue? And the second question is, which is the role of academia on researching on these day-to-day exclusions that happen many times to less powerful groups that are not highlighted in the mainstreaming dialogues about sustainable development goals, etc. How to address and highlight inequalities, not only on health care, but also on the possibility of participation for these groups.
Brilliant. Thank you, Ariel. That was very clear. We heard you this time, and very important questions around power relations and the role of academia. I'd just like to ask our panelists if you could turn on your videos, that would be great. If all of us could turn them on. And if anyone from the panel would like to respond to those questions.
Yes, I just take the part around inequalities and visibility in participation in terms of working with groups. So within the social accountability mechanism or platform. We experience that sometimes it's something you cannot run away from, but you can address it. And so from some of the things we have done experiences, the fact that yes, you bring on board, you try to bring in, or you bring in, the different stakeholders, but as some are really, really disempowered, we need to find out what are the issues that make them disempowered and are unable to confront those power relationships. First of all, we begin to build capacity and understanding and knowledge of the subject matter. And then representation is also important, because you may find out that they are within the group, but they're just lagging and tagging on, but not actually participating. So it then is something that we as practitioners should look out for when supporting platforms or mechanisms such as those, to ensure that we do not reinforce those inequalities, but look at those power relations within the group. Oftentimes, you also find out that there's a huge issue around the government, sometimes who belong to some of these platforms. So when a government official is speaking, and then there are others in there, they don't want to speak. So you need to create that environment of trust, an environment of, that breeds equality, sort of, and then to enable others to contribute freely. So that is an ongoing challenge that does not have, I would say, a bullet that can really address it. But of course, it depends on the context and how you can develop local solutions to address it. Thank you.
Alison?
Yeah, Sarah, I can mention also that I think it's important that we look at, we're doing a lot of work with resiliency, and especially at a time like this is so important, but having the capacity to see where those groups are being left out, or where you thought your system was responsive and suddenly it's not. If you don't have the capacity to recognize it, and the systems and the competencies in place to then pivot and address it, and then come back, and that brings us back, Sarah, to that good governance and data, and who's responsibility. So I think that that's going to be, and we've seen, I mean, in the United States, we're facing many challenges all at the same time right now. And it's been very interesting to kind of look at that through a lens of accountability, and who's accountable and when and where, and then are we able to pivot to address disruptions. So it's, I think that this is really an important topic, and I think just capacity building needs to be part of our social accountability development.
Adriani?
I was going to go back, thanks for the question. I was going to go back to the issue about engagement that also Esther was talking about. And I think that one thing that we need to be aware of is that even when we manage to put, let's say, accountability mechanisms in place, for example, through, if you're trying to improve quality of care, and we put together a health facility committee, and then you mandate that community members sit on that health facility committee, it can become very tokenistic very quickly. And it's one of the challenges when you try to institutionalize accountability. When the government, we had a conference a few years ago where in India, and there was a big push in one of the big states, which is bigger than many countries, to create engagement and accountability mechanisms that engage with citizens to participate on, for example, different working groups and platforms of the government. This was finally put in place and is considered quite effective. The World Bank was involved, and many others. And now at all levels of government, there in this state, there are let's say, accountability mechanisms and citizen engagement to do the recourse, the follow-up on different findings that come forward related to quality of care in the health sector. Yet today, years later, though it's institutionalized, there is questions about who sits on those panels and whether or not they actually still speak for the community. And so as we try to move towards institutionalization, I think there needs to be some guardrails to know, or to institutionalize also some turnover, some regular flexible change of who's sitting on those panels and their answerability to the community that they're supposed to be representing. So it's not an easy task to create these things that are sustainable and institutionalized, even when there's goodwill on all parts. So I do think that the equity issue, the effectiveness issue has to be carefully thought through. Thanks.
Thank you. And just to note, there's been another comment that's come in actually related to this from Nadira in Bangladesh around the power dynamics and the inequities perhaps entailed in that. So she's looking at it from race, religion, and resource, which she feels needs to be included in the accountability cycle, which I think is what some of us have spoken about. And I think while I have the floor, just to give you an example of work I did with the E4A program actually in Nigeria, where we actually thought about, we're trying to improve maternal and newborn health outcomes, but actually there's no mother from a rural community who's participating in this mechanism at the moment. It's quite high level. So how do we bring that participation in? And when we did, it was very clear that there were such power differentials in there that we actually had to work in the background to help her, because of course there was a language barrier. There was she felt uncomfortable being in a room with people who might be more literate than her. And so it took a lot of work to really get her to a place where she felt confident and comfortable to participate in these meetings. And it's not always that she's the one kind of, actively opening up the conversation or responding to questions. She'll often, work in the background or speak to others in the background. And so there's different, I think there realistically will need to be different ways and creative ways we need to think through how we solve these power differentials to really meaningfully engage people in accountability work. I'd like to just turn it over to Fidel Mukinda. If you're with us, thank you for your question. If you're able to, would you like to unmute yourself? And feel free to turn on your video to ask your question.
Good afternoon, good evening. Can you hear me?
Yes, very well.
Okay, thank you so much. It's good to hear all the presentations, very interesting. Thank you so much. My name is Fidel Mukinda. I'm a PhD student at the School of Public Health. I'm interested in accountability at local district level for maternal, newborn and child health. During the presentations, I know that accountability is relational by nature. And so reciprocity is one of the many aspects and for effective accountability mechanism. So my impressions in listening to the presentation is accountability is a one-way approach, and it kind of it lacks expression of reciprocity. I found this definition of reciprocity from Elmo in education fields. They say that reciprocity implies that for every unit of performance that I require of you, I also owe you a unit of capacity to produce that result. So coming to the framework that you presented, do you think that reciprocity is a missing marker in that framework that you suggested, which is very interesting? I use it in my reading and writing. And also, can you or someone share any experience, in practical experience, related to the application of reciprocity in accountability? Thank you so much.
Thank you, Fidel, for your question. I'll first ask the panel if they have any comments to that question.
Sarah, I would need just a little bit more clarification on the question exactly. Maybe you can start and then I can jump in.
Okay, sure. So from what I understand, Fideli, you'd like to know more about kind of the two-way relationship, I think, between, I guess, different stakeholders, particularly duty bearers and rights holders. So maybe I can speak a little bit to that. And I know certainly in a lot of our work that we do around accountability, it's never us against them, an us against them approach. It's very much a collaborative approach where we try to instill and collaboratively engage in discussions to really help solve the problems at hand. So for example, the accountability work that we do, we certainly engage civil society organizations, but part of that also includes, for example, government representation, representation from healthcare providers, from beneficiaries themselves. So it really becomes a more representative membership that is actually tuning in and honing in on what are the issues based on what the evidence is suggesting. So I would say, you know, in a short response to your question, that I think the composition of accountability mechanisms is very important, because I think that in itself helps to instill this two-way dialogue in that relationship, and you avoid pitting one stakeholder group against another. And at the end of the day, I mean, the goals that you're working towards really are the same. It may be that there's different actions you can take depending on, you know, where you sit in the system, but certainly everyone, I think, has a role to play. And as long as they're committed and wanting to pursue and have the willingness to do so, I think that we need to just be careful about who we're engaging, how we're engaging, and making sure it's as equitable as possible.
And just to add to that, I mean, I think that, as Sarah mentioned, some of the best success that we've had in implementing accountability mechanisms has really been where the evidence of the problem has been embraced and recognized by all of the actors, duty bearers and rights holders, and then in partnership, they are able to dialogue through face-to-face meetings or other platforms and really come together to identify where is the problem and what are the possible solutions. One of the biggest successes we had, I think, was in really getting the community to understand the challenges also faced by the providers and how they themselves were constrained. It's not that they didn't want to provide this or that, but that they actually either didn't have the skills or the capacities in terms of the equipment and other things to be able to do a better job. And when there's greater understanding between the two, then they were able actually to partner together to put pressure on the system, on the Ministry of Health, to actually deliver more for the facility. And it's in those kinds of partnerships that you start to create mechanisms that work for both the community and the providers on the front line. In the end, they tend to find that they have more in common than they thought. And I do think that it's really important for an accountability mechanism to be successful to exactly not pit one against the other, but actually to create partnerships. Otherwise, it just breaks down and then no one gets engaged. So that would be my contribution there.
Thanks, Adriani. I'd like to move to Mary Hadley, if you're on the line, if you'd like to ask your question. Otherwise, I'll ask on her behalf. So she has a question on considering the level of nepotism and the culture of accountability within a country or region, and whether that could be factored in as an additional enabler. She's imagining the difference sort of in country context between, for example, Rwanda, Zanzibar, etc. Anyone have an immediate response to that?
Sure, it would also be interesting if any of the participants have a comment or thought on that in terms of nepotism and other kinds of issues. Because I can see that some of the participants are very well versed in accountability.
Okay, while maybe our participants are thinking about that, I do have another question from Rachel. Sorry if I'm pronouncing Mbalu. If you are on the line, if you don't mind unmuting and ask your question. Rachel, I can see you're there. Are you able to unmute yourself? Okay, I will ask her question. Rachel, are you with us? Okay, I can't seem to hear her, so apologies, Rachel. I'll ask the question on your behalf. So she's interested in, you know, she's heard of us speak around public participation as being a very crucial component of social accountability. Given that it offers the targeted beneficiaries an opportunity to engage with duty bearers in decision-making processes, feedback, health sector investments, planning, and budgeting. So how do we best ensure that the government adopts a people-centered approach, especially in planning and delivery of healthcare services? An example of this gap is in Kenya, where in the current healthcare workers strike, where they feel their grievances have not been addressed by the various levels of government. Obviously, the people who are bearing the cost of this crisis are the poor, who rarely have a chance to sit in on the decision-making table.
Adriana, I know, was talking about how providers then become the rights holders, and the importance of mechanisms that enable them to complain. And I actually love the way that Brazil has a very dynamic engagement mechanism and accountability mechanism for the government.
Thanks. I think, Esther, did you want to come in?
Okay, just wanted to, yes, speak a little on that. Of course, when you look at when there's crisis between the service providers and government, of course, the community or beneficiaries to suffer. But again, we can look at, you know, in putting up some of those accountability mechanisms, we can talk about representation, right? And so she's feeling that the representation of this group, so how can this group come together? Because it's not everything we can have in the framework to say, but practically this is happening. We can, or what necessarily comes to my mind right now is, how do we organize this sector to also have a voice? Okay, the beneficiaries at that level, how are they organized and how are they represented in some of these discussions? So again, and in terms of representation, oftentimes you can find out that there's power play that comes in. But then again, how are they supported to break down or identify the powers, you know, and which and how to engage, or who is, you know, along the power ladder, who you can engage with and then get represented at that level. So for me, it boils down to, you know, coming together as a collective and being represented by themselves, of course. And then I would also like to take a shot at the previous question that talked about, she said, could we include nepotism as also a marker in terms of the accountability framework? Of course, when you're taking on accountability approaches, or even taking on accountability for issues, even outside of the health sector and all that, nepotism is actually a big issue to consider. And thinking about nepotism, if at all it could get into the accountability framework, if we look at it around the awareness level, where people get to understand that merit is important, and not just people getting to the place without right qualifications or who does this. So that could be a marker, it could be, but then it plays a bigger role under in terms of awareness raising, where people are getting to understand what accountability is, why accountability, and how accountability should be practiced. Thank you.
Great, thank you. I think we'll have time for one more question and then we'll wrap up. But there's a couple of questions along the same lines actually from colleagues in Nepal and Kenya. And the question is whether governments should indeed or in fact be part of accountability structures or mechanisms when that structure itself is holding governments to account for their actions. So how do you reconcile that?
Well, that's an interesting question. And yes, based on a model that we have used in evidence for action, I would say that looking at it, I've worked in two different sectors before now. And if I take out my experience in my previous line of work or where I worked before, and I was also engaged in accountability. There, we did accountability work without the government's involvement. But I've seen a remarkable change or remarkable success when government is involved. And so it's basically because there's a lack of understanding. You can go ahead as a group of rights bearers, you take on an assessment and you take it to the government, and there's that friction, there's that pushback, and there's no acceptance. But you can also decide to get government involved in the process of an assessment, and then you collectively agree on the results. No one is, you're not trying to hide it. Everything is put on the table and it's transparently done. Maybe I give you an example where we were developing a scorecard in one of our states in Nigeria. And for the very first time we were doing that scorecard in Lagos, we asked for the data which the government brought in from the health, the DHIS, and we looked at it, the coalition looked at it and produced a scorecard. And there were a whole lot of, the scorecard using the traffic light approach, and there were a whole lot of reds on it. And these people were like, oh, we've been collecting, we think we are a center of excellence, we've been doing a lot of good work, but we didn't realize that we had all of these, poor performance in most of these areas. So it helps to give that understanding, in-depth understanding of the issues and acceptance of the issue. And one other thing it does is the fact that it enables them understand that civil society or duty bearers are not here to attack, but rather they are here to co-create and develop solutions collectively. And so where those barriers are being broken, then there's trust that is built and everyone comes to the table transparently to assess themselves. So like when I was giving some of the examples I said earlier, I said there's a self-assessment process right now going on within the government. So when they have, working together as a group, as a collective, collaboratively, oftentimes in the process of institutionalizing accountability, you then find out that the government has adopted the practice of self-assessment and knows that, oh, someone is watching, duty bearers will ask questions, and then, we have to respond to this. And so again, that's, opens them up for transparent practices and collectively addressing and acting on issues. Thank you.
Thank you, Esther. Just looking at the time, we should probably wrap up. I know there's a couple of other questions and a hand raised, but we can certainly continue the conversation offline. Just want to end off with a couple of remarks. We know, hearing from our panelists today, and also from your questions, actually, that accountability is at the heart of a change agenda, particularly now more than ever with the crisis we're currently facing. So factors that we need to consider include robust and strategic use of data, transparency of this data and the decisions being made, equity, power differentials, multi-sectoral partnerships, political will, and targeted action will hopefully combined will instill greater confidence and trust in the health system, as well as advance health outcomes. Measuring, which is what we talked about today, on how we're using accountability to progress these efforts will be critical. So as noted, this session was based on a paper that was published in Health Policy and Planning. So do read up on that if you'd like more information. And of course, if you would like to continue the conversation, please do get in touch with any one of us. We'd be happy to engage in this discussion further. In the meantime, I would like to say a very, very big thank you to all of our panelists. Thank you so much for your participation, and also to the audience for listening in and asking those really relevant questions. Thank you so much, everyone, for joining us, and goodbye for now.